Yeah, but I think it's time now, and we're proud to present Audientes. Again, we are moving into the health solution side, but of course here the impact is also very, very great, especially if you can make it more affordable and more, get out to more patients, and that is what the Audientes case is about. But not to jump to your presentation, so I will leave to you to explain that, Sten.
Yeah. All right. Well, let's jump into it. Welcome to Audientes. We're a Danish mission-based technology company that are creating affordable and accessible solutions in the field of hearing solutions. So today I will take you quickly through our overall impact story, and of course focus on what it is that we're trying to do to alleviate hearing loss around the world in a new way. And of course, we'll also focus on the actual investment case in Audientes, what it is that makes us a great sustainable business case in the long term. Many of you may have come across us in the past, but we are essentially founded back in 2014 and went public on the Nasdaq First North growth market in Copenhagen in September 2020. We are on our way to launch our first product later this year. And essentially, our key focus is on markets that are quite far away from Denmark, Scandinavia, and Europe. So basically, the Asian market space is where we have been spending most of our time so far, in particular in India, which I will come back to later. And why is this the case? Well, in the world where there are around 500 million people with disabling hearing loss, most of the people that today does not have a solution and typically cannot afford or access a solution are actually based in the developing economies, and in the very people heavy economies in Asia is where there is significant challenges to be solved, and that is really our key focus. The impact we have that we are seeking is really across 3 regions, and this is really a timeline view, so to speak, where we initially focus all our effort and talent on India and the Asian, you can say, surrounding markets where the demographics and macroeconomic conditions are really ideal for what we are talking about. We are on a trajectory, which I will cover a bit later, on also securing FDA clearance for our product, and later also the European medical device approval is also in our crosshairs. But in order to really understand the magnitude of what we're talking about when we say 500 million people in the world, I included this graphic from hearaid.org, which published a report, I believe it was last year, around the numbers and costs involved in actually hearing loss. So we talk about 400 million people in the world that may not have a solution today. In the EU, there's around 23 million people today that does not have a solution either. So this actually costs, according to the report, the EU around 185 billion euros annually, which somehow converts to 8,200 euros per person per year, basically having untreated hearing loss. So this is what we are talking about. There's a huge social return on the investment that we can make in Audientes, and companies in this space that are providing affordable solution that reach new people that today does not have a solution. And basically, why is this important? Well, according to the report and according to a lot of research, most of people today does not have a solution, even if they have hearing loss. So 2 out of 3 is the kind of number according to the report. And there is really negative consequences involved in having untreated hearing loss. It leads to sort of a negative spiral of poor mental health and other aspects. Whereas contrary, people who have a solution seem to lead a better life and with less burden on society. So this is the kind of, you can say, the focus we have on having an impact on. If we sort of make it really tangible, what can we do and where can we have our effort is best placed? We have really chosen to align ourselves with 3 of the UN Sustainable Development Goals. So no poverty, number 1. Number 3 is good health and well-being. And number 10 is reduced inequalities. And just really to put a few more words on them, essentially, no poverty, we have an effect on that by reducing hearing loss in the countries that we have just talked a bit about, and basically the economic hardship that follows not being able to hear, typically cannot keep up a job, and also which leads to this negative spiral of lack of economic independence, loss of contact with people around one, and also maybe not being able to access education and so forth. The second area, good health and well-being, is really about mitigating the mental and physical challenges that is involved with basically hearing loss. And longer-term untreated hearing loss can really lead to this spiral that also goes in the direction of sort of early dementia, but definitely also depression, anxiety, and also not being able to actually move around safely in society. And then finally, the sort of key point also around number 10, reduced inequalities. When you have a hearing loss, you are often discriminated against because you are not really involved in society and in the labor market as one could be and should be. So again, treatment of hearing loss should not depend on one being very wealthy or live very close to an audiologist. We need better solution to address this. And this is essentially what we are really driving forward with our solution. This may be sort of a good idea to just understand what is it exactly that we do in Audientes that can help address this. Well, it is really linked with how the conventional industry works today, where it's a quite complex and also in many countries costly process of having a hearing aid measured out and fitted. And of course, acquiring the product is now also sort of a significant step up for many. But without diving into too much detail here, but the process really has many steps that involve being close to an hearing expert that can carry out a hearing test, that can identify the right kind of hearing aid and the amplification needed, and then basically program that into the product on an ongoing basis, help fit the product, in a sort of way that is called fine tuning. So where the brain adapts to suddenly having hearing well done again. So you can actually, you have to turn up the volume over time, which means repeated visits to the audiologist. And in many countries, including India, as we are talking a bit about here, there's really significant challenges in actually traveling maybe many hours to get to a place, but also in many places there is not an expert available. In India, there's one hearing specialist for every 500,000 citizens. So there's a significant systemic problem around access to good hearing health. So the key problems we have to overcome in this field of addressing hearing loss really is definitely related to the cost of the actual product. So the acquisition cost, but also using it on an ongoing basis. It costs in sort of weekly terms. You have to basically buy a new battery every week for many products, which means something like $30 to $60 per year just in battery costs alone. And then you can sort of add to that the costly process, but also, the shortage of experts that can help. So what do people do? They go and look for less costly solutions, and they will definitely often pick up, if they can, an amplifier, a hearing amplifier that unfortunately amplifies uncritically across the whole frequency spectrum and doesn't really take into consideration where the person can hear well. So you end up with having too much amplification where you can hear, which leads to essentially poor loss in those areas as well, because the hearing is being damaged. So this is not, you can say, something that is super easy to address, but we believe we have a really good solution for that. And our solution is essentially something we've been working on for some years and are now introducing to the market. We call it a simple to use standalone solution, where the whole complex process of a hearing clinic and everything that follows that has been digitalized and built into the product. So all the steps is now built in, where you essentially acquire the product, you put it on, you run the built-in hearing test, you sort of respond to the pure tones that are being played in your ear. And once you've done that, the hearing is being basically, the amplification is programmed to suit the individual person's hearing. So this is a very easily accessible solution that can be sold anywhere and used literally anywhere by the end user. And we have also developed a nice, easily understandable and nicely looking app that runs on Android and iPhone OSs. So basically you can see your hearing profile mapped out, and you can also have access to figuring out, where to adjust and maybe build some specific programs for certain situations. So better user experience, of course, on that platform. But essentially we have taken everything that you can say exists in this space and built into one nicely self-contained solution. It runs on the key standards that are used in the industry, like NAL NL2, which is the default prescription algorithm used by hearing professionals around the world. We have, as the first company in the world, built that into an actual product. So in the product, running in runtime and so forth. And with our self-fitting technology, we think this is something that really can help a lot of people around the markets we see key problems in. And when you couple that with sort of practical things like rechargeable battery and even the ability to stream music and sound from a smartphone or a TV, this is, in our view, a really versatile offering that can help a lot of people around the world. So where do we actually, if you get into the business case around what we do, how do we position ourselves? And essentially, there's two markets that I just want to sort of, highlight here. One is the classic medtech market that are really selling through established channels, B2B, high quality clinical type of products. Three of the companies happens to be Danish, and they do, really, really good products. On the other side, you have the consumer tech space with a very colorful composition of large tech firms and many other audio and other companies trying to sort of bring out exciting solutions all the time at a much faster pace. And market size, the hearing aid market is around $9 billion annual market, 17 million units sold, whereas the consumer tech space is more than 20 times that size, and they sell many hundreds of millions of products per year. So we're a pure play, and we're positioned out in the crosshairs of where these two markets intersect. And this is where this new market that are, according to Gartner Group, worth around $40 billion already this year, a new market of products that are often called hearables, but that is combining, the best of both worlds. And that is our focus. Our focus, though, is high technology, but at a lower cost than typically is known in the industry, especially around the hearing aid space. So this is essentially where we are going out and positioning us very clearly in. Let's go into sort of the issue around hearing around the world. So in India, of course, with 1.3 billion people and a lot of cities with more than 1 million citizens, is a significant opportunity in its own right. And there's around 100 million people in India in 2023 that is suffering from disabling hearing loss. And around 8.5 million in that time will actually have a hearing solution. So one can see there is more than 90 million people that doesn't have a solution at that stage. So this is where we see, if we can solve access to the product and deliver it at an affordable price, this is essentially fantastic space for us to start. In India, the cities, of course, are not the same. It happens to be that 33% lives in the large cities, whereas 2/3 lives in rural India. So, this really has a significant impact on how will people actually access and buy products. Now, it happens to be that in India, like everywhere else, e-commerce is booming. So we are able now to go to market, not only through the established clinics and channels that we are basically developing with a recent announcement the other day with hearing wellness clinics in India around marketing and selling of our product, but we're also exploring the whole e-commerce channel. And basically, cities like Bangalore with more than 10 million citizens is of course very different than rural India, where there is not an audiologist inside for, hours. So this is essentially what we are now driving towards with a combined go-to-market model that combines e-commerce with basically good access through established clinics. So the value creation journey that we are on right now is essentially completing the product, entering the mass production phase, making the commercial agreements, and then launching the product into this market this year, where we'll basically be seeing our first sales milestones later this year as well. A bit longer term, but still, in the foreseeable future in 2022, this is when we are essentially expecting the clearance from FDA for a solution we can introduce in the North American market, and for that sake, other markets that are leaning heavily on FDA, and then also taking the route through the European approval process and bringing out a nicely, fit for purpose product also in the European space. We are busy now establishing our Indian subsidiary, which we announced a few weeks ago now, and we are busy building sales channels, and essentially, which means that we are really now in the process of making things happen. And this year, we expect to sell the first 7,000 products, which lead to this revenue generation of around 3.5 to 5 million Danish kroner, and we continue, of course, to invest in our business in the range of 12 to 14 million kroner this year at an EBITDA level. And finally, I will just really sort of try to bring it all together and highlight why is Audientes a really good case also for impact-oriented investors. And that is because we are addressing this rapidly growing problem that, according to WHO, means that 900 million people by 2050 will have disabling hearing loss and need solutions. The current industry doesn't scale in any way to meet that need. So there's a need for players like us who think differently and act with new product concepts and new go-to-market channels. So I think we have a great, very unique positioning, and we have got a good team assembled here in Denmark, in Virum, north of Copenhagen, with extensive expertise in all the relevant areas, including now we are building a strong Indian organization with Raman, our country manager. You can see here, he's been out testing the product with people in clinics around larger Indian cities here in the first quarter. So we have really, I would say, a very strong proposition in this market. And I just want to say, please follow us. We publish a quarterly investor newsletter, and we are quite active on social media on basically sharing what we do with people who are interested in following us. And that was what I had prepared, Michael, and everyone else. I hope this is interesting. And
perfect. There are some questions, and I don't think you elaborated on it, but why don't the existing big producers you showed in the left side of the slide, why don't they address this? It's an impact they could go into. It's a potentially huge market. So are there any reason why they are not addressing those markets, the big 4 or 5 hearing aid producers?
Well, I certainly think that they are looking towards this issue of consumerization of hearing devices. We have got several stronger, well-known brands like Bose entering the hearing aid space, and I've seen even Jabra now being used for hearing aids in the US. Got classic hearing aids, but still really trying to introduce hearing aids to a broader population. I think the focus we have, the direction we are taking with the pricing and the actual building it all together in one solution. Some of the existing actors are really anchored in their existing go-to-market models and, of course, high-margin businesses. So they may not have the motivation to actually pursue these new kind of grounds as we do, because we don't have any legacy in this way.
The classical, the disruptor is let a little bit free until it gets too big and too irritating. Yes. So and there's a little bit of asking about the timing of your product. Why now? Yeah. Why this has been a problem for a long time? Is that the technology has evolved, so now it's possible to do this?
Well, it's definitely possible for us to do it now. We have, of course, been developing a solution and testing it, but there has to be essentially a platform for a company like us to take the product to market, and this is the time now for us. In overall market terms, I think a lot has happened in making the actual underlying enablers ripe. So basically, stronger processing capabilities, a lower battery consumption, and all these things. This is now a great time to launch solutions into this space. And also, I think there has been this trend around the world that people are accepting that you can buy great solutions basically over the counter, online and otherwise, but you don't necessarily always have to get someone in so we say Danish in a white kind of garment, consulting with you. You can actually help yourself. So this self-help trend is also a big driver for why this is a good time.
And competition, are you seeing any others moving into the space? Are you seeing any signs? You elaborated a bit about on the Jabra brand being used. Are you seeing some movements on the competitive side? And does that actually mean that you like that competitors might be able to help evolve this market, or would you prefer to have it for yourself?
No.
It's a bit of a leading question.
No, I think you can see from the magnitude of the problem that this is really something that we need to have more than, you can say, one new actor trying to do something with. So this is about enlarging the size of the opportunity. So you can say have a significant impact as an industry, and we need more players in that field as well. And there are more players. There are some really interesting players, Silicon Valley funded, and even all the way to Australia. But there are some good companies out there doing solutions. Most are focusing on selling them into the Western, you can say, economies where maybe people can spend more money on those solutions. But there is definitely, a lot of good things happening, and I think this is driving innovation across the industry.
Perfect.
And I mean, basically, there are other stock exchange listed companies also in this hearable space. So this is something that I think there's other good companies trying to do the same as we're doing from a sort of innovation point. So that's really exciting.
And about let's end up with the last question. How do you price compared to Jabra and Bose? So how are you thinking about? Are you always wanted to be the cheapest, or how are you placing yourself?
Yeah, so we're going to market with a product around $300, maybe plus a bit depending on local sales taxes. But so this is really like in the lower level of the hearing aid price, but where we try to offer a really good quality offering. The Bose is something like around 3 times that, but that's also a different form factor. It's a classic hearing aid that sits behind the ear, and really a quite different concept using ordinary batteries. Jabra is, I think, also in that price range or higher, selling through Costco and so on in the US. So it's. I think we want to be in the part where more people can afford it than not, and I would certainly like us to see going down over time in terms of portfolio reach. Also being able to offer solutions for people with even less buying power.
Perfect. I think that rounds up the day. Thank you, Steen, for taking us through your way of doing the impact and how you're actually going to turn it out to a business also.
Thanks for the opportunity. Thanks.